Hello, Bulldogs. It's Mr. Copperwood again this week, coming to you from the counseling office at Lamar's Community High School with Bulldogs in the Workforce. This week, we are focusing on the career of dental hygiene, and our featured dental hygienist is Leah Clement, who is now Leah Christoffel, and she is a 2011 graduate of Lamar's Community High School. And Leah currently is a dental hygienist here in town at Genery Dental. It's really cool to see a dental hygienist like Leah, who's a graduate of Lamar's Community High School, because we've got several graduates of Lamar's community who are current dental hygienists or are studying to become dental hygienists. So it's a very popular field right now, and it's really cool for us to see so many graduates from our school that have moved on to that profession. And Leah is just one example of that. So you're going to hear from Leah today, and she's going to be telling you more about becoming a dental hygienist. Um, so Leah Clement, 2011 graduate, Lamar's Community High School, talking about dental hygiene. Again, Bulldogs in the Workforce this week from the counseling office at Lamar's Community High School, always trying to improve our college and career readiness. So here's Leah Clement, now Leah Christoffel.
Hi, I'm Leah Christoffel. I graduated from LCHS in 2011. I am currently a dental hygienist here in Lamar's at Genery Dental. I have been here for about 4.5 years now. I attended school at Hawkeye Community College, which is in Waterloo, Iowa. The dental hygiene program takes about 4 years. You do 2 years of your prerequisite classes, which are a lot of sciences, chemistries, anatomy, and then your general education courses. And then you have 2 years in the dental hygiene program, which that is all of your head, neck, and mouth classes. You have all your clinical rotations in those 2 years, and you learn all the hands-on portion of being a dental hygienist. I would strongly recommend this profession if you're interested in the health sciences or to look into it, because that's kind of how I got my interest. I knew I wanted to go into the healthcare field and ended up finding out that dental hygiene was a great fit for me. So in order to become a dental hygienist, you need to earn your degree in dental hygiene, get an Associate of Applied Science. Then you have to pass a national written and clinical board exam. Along with that, every 2 years you need to complete 30 hours of continuing education to keep your license. The great thing though about becoming a dental hygienist is that you only need an associate's degree. You can earn a bachelor's or master's, but that would be more for if you were looking to go into business, education, or public health. You can get an assisting degree at WIT, pretty close, in Sioux City, but there is quite a bit of difference between a dental assistant and a dental hygienist. There is more schooling involved in becoming a dental hygienist, and obviously a lot more schooling involved in becoming a dentist, where that would be about 8 years. So dental hygiene as a whole is about 4 years. You can get that completed. So on a daily basis as a dental hygienist, we perform preventative treatment, which we call a dental prophylaxis on healthy patients, or a periodontal maintenance on patients that have more advanced gum diseases. I apply sealants, fluoride treatments, we take dental x-rays, I administer local anesthetic, which is also known as numbing the patient, and we also assist the dentist in diagnosing any diseases of the mouth, such as cavities or periodontal disease. On a typical day, I see about 8 patients. We usually see about 1 per hour. I work Monday through Thursday here, 4 days a week, which is a great perk to go into for the dental field. So another really important and kind of fun part of my daily job is educating patients on proper oral hygiene care at home. So we have a lot of products that we recommend. So I kind of go base by base on what's good for each patient. So we have prescription toothpastes that we give out for people that may have issues with cavities or dry mouth. We have different types of flossers that we give out and mouth rinses on a daily basis that help healing and fight gingivitis. We also apply fluoride treatments, which I talked about before, and I can help demonstrate in the chair here how patients can properly brush their teeth at home and take care of their mouths. So not only when they come in for their 6-month cleaning or 3-month, 4-month cleaning, they can do these things at home as well. So this is a typical cassette that I would use for a healthy adult patient. This is a hand mirror, we have a probe, an explorer, and then I have several scalers and curettes, we call them. And this is what I would use on a healthy patient, like I said. We also have a polisher, which you may have heard of before. We do this most of the time to remove stain off of patients' teeth, and floss and some gauze, usually have in my normal setup. We also have to be able to sharpen all of these instruments, so we are taught in dental hygiene school how to keep all the instruments sharp so that we can effectively clean patients' teeth every day. So this is a typical x-ray unit that you would find in most dental offices. We have digital x-rays or radiographs, what we call them. So I can hook this into our computer and we can instantly see the image that we just have exposed to the patient. We use a sensor, place that in the mouth. We can take a picture of about any tooth we really want to see. The most common ones you've probably heard of are bite wing x-rays, and those we use to detect cavities and gum disease. And this is what a typical dental chart would look like. We have to be able to chart missing teeth, restorations that they've had, or things that are diagnosed by the dentist. After each patient, we need to fill out a clinical note, which is a legal document that documents the entire appointment that we have, and we keep that on record for patients so that we can kind of follow their treatment throughout each visit and time that they come in. So at the end of an appointment, we have to take all the instruments that we use throughout that appointment. We take them into here, which is our sterilization room, and we first start by shaking them over here to get all the debris off, and then we let them dry for about 45 minutes, and then we come over and we wrap them up and put an indicator strip in them to make sure that they're sterile, and then we place them in these sterilizers. We have a pretty large office, so we have about 3 of these in here, and they're usually running all the time. But when you have free time in the dental field, you're usually either in the sterilization room doing the charting that we talked about, or little odds and ends around the office. So what I would say it takes to be successful at this job is to be very attentive to detail and your ability to adapt to change, because in the dental world things are always changing and you need to learn how to do things differently than what you might have been used to before. Some advice for people that are looking or even considering going into dental hygiene would be, if you are interested in you're in high school right now, I would apply for the program. I believe there's 5 different programs in Iowa, but apply right away so that you get on that wait list. And even if you don't for sure go into it, you're on that wait list, because most dental hygiene programs in Iowa do have a wait list. So once you are already applied and you take your prerequisites, you are automatically on that list for most schools to get into the program. So one thing people may be unaware of when going into the dental field, though, is how it does take a toll on your body. You're always moving, so it is important to practice proper ergonomics, which is good posture. I use these loops every day, which help me see into the patient's mouth. I can magnify to help see. I also have a light on here, which really is helpful. But also stretching, drinking plenty of water throughout the day, because like I said, it does take a toll on your body. But I would say a great thing about my job is that I'm able to help improve not only oral health, but overall body health, because the mouth and the rest of the body are connected, and we're finding a lot of links between things that we find in the mouth and other things going on in your body. So it is a very rewarding job. I enjoy coming to work every day, and I would strongly consider looking into dental hygiene if that is something that you're interested in. Good luck.